That's me.
It's 2 o'clock. Let's call the Sinclair County Board of Commissioners meeting to order, February 17th. Stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call.
Commissioner McConnell.
Here.
Commissioner Baldwin.
Here.
Commissioner Beeden.
Present.
Commissioner Dunn. Commissioner Rushing.
Here.
Commissioner Vandenbosch.
Here.
Chairman Bohm.
Here. Any additions, deletions, changes to the agenda? Seeing none, can I have an approval for the agenda? Motion.
So moved. Support.
All in favor?
Aye.
Those opposed. Item 5, minutes of the previous meetings, items A and B.
At this time, I move to approve and file the minutes of January 20th, 2022 commission meeting and the February 3rd, 2022 standing committee meetings. Support.
Discussion on any of these? All in favor?
Aye.
Those opposed. Actually, it probably should just say the reason we had to move this meeting up tonight, we have our MTA event, which is all our, 31 township cities? 23 townships. And this is an opportunity to get in front of everybody. That is at 6 p.m. this evening. So items, no proclamations. Item 7, consent agenda. Items A through D.
I would make a motion to approve items 7A through D on the consent agenda.
Support.
Discussion on any of these? All in favor?
Aye.
Those opposed. Reports of standing and special committees. Mr. Vandenbosch.
I don't think I have anything today until there are other committees later on down the road for.
You want to touch base a little bit? I know you were, for those of you that don't know this, in attendance, Dave's the assistant fire chief in Marine City. Had an unfortunate situation at the new power plant down yesterday, and you guys got called out on that? You want to
Yeah,
touch base?
believe it was 7, 8 fire departments there. It was some, it looks like it may have been a welding accident. We're still waiting for, to actually find out for sure. They had people in position, but actually was outside where actually the fire started. So, but it was put out, I think we were there about 4 hours, 4 to 5 hours, so.
Okay.
But there is some extensive damage in some of the areas.
Very good.
I got
Commissioner
nothing.
Rush. Mr. McConnell.
I'm good, thanks.
Commissioner Baldwin.
Yesterday at the Metro Planning meeting, we found out that there's a winter bird blast event Saturday, February 19th. That's a bird talk and walk from 9 to noon. So I was asked to share that information with anyone who may like to see that. And the information would be on social media and on the webpage, I think. So I'm sharing that from Metro Planning.
Okay.
Nothing
Commissioner
to
Bean.
report?
I am going to, Carrie's going to talk about this in her report. Gypsy Moss, I did receive a phone call from Casco Township asking about it, kind of next steps, and I know that's going to be in your administration report. We're going to move on to citizens wishing to address the board. Geneva Bivens, Port Huron.
Good afternoon, everyone. Welcome to day 704 of 2 weeks to flatten the curve. Today I'm speaking on behalf of myself and my husband, who had to work this afternoon. We support going back to 2 positions within the health department and not renewing Dr. Mercantant's contract. There have been many instances throughout the pandemic that the people of this county would have benefited from 2 positions as they were in the past. For example, excuse me. On more than one occasion, Mercantant stated she didn't have information before issuing a health order. Information available with a few keystrokes and a quick search. Did she not have the time to look it up? The health department doesn't track adverse reactions and deaths related to vaccines, extremely important data related to the health of our community. They don't track the harms of masks, despite orders issued by the health department. If you're going to mandate something, shouldn't you also track the harms caused by those recommendations or mandates? Do they not have the time to track and review that information? Information critical to the health and well-being of every citizen in this community. What else is not being tracked that's detrimental to the health and well-being of everyone here? I noticed that it was stated in a recommendation for the health department positions in, Mercantant's contract that St. Clair County has only issued 2 mandates. Every mandate that was implemented in this county was issued as soon as Dr. Mercantant posted public notice that she would be enforcing those mandates, whether they were handed down from the governor, Michigan Health Department, or otherwise, they were still issued in St. Clair County by Mercantant, every single one of them. The community has taken notice and aired grievances to this board on several occasions. Commissioners have also commented on issues. Although this might not have been an issue prior to 2020, normal cold and flu seasons, clearly it has been an issue since. 2 weeks to flatten the curve, March 15th, 2020, 704 days ago when this all began. Think about it, 704 days, almost 2 years. 2 years that the people have been denied high-quality healthcare services that they pay for, that they deserve from our county health department under the direction of an individual that holds 2 positions. It is our belief that if the health officer had more time to perform those job duties of 1 position,
About 15 seconds.
instead of the duties of 2, the people would have fared much better throughout the pandemic and would also fare better during the best of times. Splitting the position of health officer and medical director is in the best interest of the people, as well as not renewing Mercantant's contract. Thank you.
That was Brenda, right? Yeah. Okay. Dr. Kosh?
Sorry for my handwriting.
Well, you're a doctor, right? It's a joke.
Dr. Rajat Prakash. Just to give a 2-second background, I'm originally from India. I trained in Scotland in a teaching hospital. Then I worked in England for 3 years, worked at Henry Ford Hospital in Detroit for another 8 years, and been very fortunate to place where I belong to is Port Huron for the last 19 years. The reason I've come here is just to talk about the principles. Now, I have a background of medicine in Europe, from India where I did my training, and now in the US for the last 25 years. The reason I'm here is that amongst all the developed nations in the world, we rank the last in the developed nations. I repeat, we rank last in healthcare outcomes in the world amongst developed nations. We spend $12,000 per person in this country compared to number 1 in the world, only $5,000. What I see as an outsider and as an insider, we debate too many things for too long. The reason this country was great, because people believed in one thing. A lot of people in the room here, we all support veterans. When the army goes and fights, whether it's Middle East, whether in Uzbekistan or anywhere else, when American troops go, the commander gives a order, you follow it. You may have your opinions, and it's okay to have an opinion. You follow what the commander says, and you choose the best commander. It does not mean he's always right. Intention should be right. What you do is right. The principle behind that should be right. You believe in the right thing. Then you may take a right decision. In hindsight, you may not have done the best thing. I've known Dr. Mercantile for over 20 years. When she was a practicing physician, I took care of her patients in the hospital. I'm board certified in hospital medicine. That's all I've done for 28 years. Did I always agree with her? No. Did she do a good job? Fantastic job. Did she always agree with me? I'm just coming from the hospital. Every single patient, we consultants differ on each other. But the principle we follow is to do the best. Medicine is an artistic science, and it's a scientific art. I always tell the patient, she says, Doc, are you sure this is going to work? I said, look, I can just do my best. Let's leave it in the hands of God. Dr. Mercantile is an exceptionally good person. She could have made tons of money doing what she was doing, but she came and did this job because people like me were ecstatic the fact what she's doing. Is everything correct all the time? Heck no, but depends how you're looking at it. When I was growing up, my mother used to put eggplant on the table, cooked eggplant, and Dad said, you're going to eat it. I said, no, Dad, I'm not going to eat it. He said, okay, son, get up and go. You come back in the evening, the same eggplant is sitting on my plate, and I had to finish the damn eggplant.
About 15 seconds, please.
And what I'm driving at here is, that time I thought I was right, but my dad was right. Now looking back, he was right. Dr. Mercantile is the right person for this job because we can debate this thing back and forth, but you always have to look at the bigger picture. Thank you.
Vicki Blackburn.
Hi there. I think I'm mostly talking to a couple of people. So, this should be a very short part of the meeting because you are suggesting, a couple of you, are suggesting that Dr. Mercantile's position be divided into 2 positions, and also with the implication that her contract would not be renewed. Well, the good news, to make this short, is that there is no open position. She's been shown to be an exemplary employee by all of the letters that you've received in the meeting last time where you as a board voted your vote of confidence in Dr. Mercantile by not censuring her, which would have been a big mistake anyway. So, second thing, if you were to go ahead and post this position, which is not even open, you're walking on thin ice. Thin ice. you would have to pay more money to get someone else. You would have to advertise. You would have to find out that there's not even people in this state that are qualified to take the position that you're so easily recommending be taken. I'm here to say that my belief is there's some politics going on here, and I don't like it. I expect Dr. Mercantile to be treated with the utmost respect, and for her to be supported and respected by those of you that are calling yourselves her boss. Well, no, the law and citizens like me that are watching all of you like a hawk and have been hanging out at the county building every day, trying to get some FOIA things through, that finally had to get legal assistance to do that and got the information late yesterday. Unacceptable. I had people lie to me. I had people say that it was too much for me to read, implying that I wasn't smart enough to read it. I looked.
15 seconds, please.
All right. Then here we are again.
Have you finished up?
No.
Well, your time's up.
I'm sorry? Keep going?
They don't, all due respect, people from the audience can't. If you could wrap it up, please.
Okay, I can wrap it up in just a few seconds. I expect you to have integrity.
Mary Conlon, I'm sorry, Birchville.
Mary Conlon?
Hi, thank you for your time. My name's Mary Conlon. I'm from Birchville Township. I'd like to say one thing about the doctors, what he brought up. He said he was from India. The largest city in India eradicated COVID by giving every family ivermectin packets with the vitamins and everything else. That's not an option for us, and I'd like to know why. I have never taken a vaccine. I don't believe in them, flu, whatever. I do everything holistic. Why am I not allowed to use ivermectin and hydrochloroquine, vitamin C, vitamin D, zinc, and the healthy protocols? We don't even pass them out to our kids in school so that we can boost their immune systems to help keep them healthy, which for all the money you got for this COVID, we should be putting that into our kids to make them healthier. I got a letter from Dr. McConte because I did get COVID. I did get from frontline doctors hydrochloroquine and ivermectin to combat it. But I was in that letter, she threatened to put out a warrant for my arrest, and I didn't appreciate it. I got calls from the health department. I got calls from the state when I told them I was under my Privacy Act and I was doing fine. They continued to call me. It's my life, it's my health, and I don't understand. You know, she can set up mandates and say, this is what I suggest we do. It's a mandate, it's not a law. So please allow us to treat ourselves the way we feel it's healthiest to treat ourselves. Do I trust the vaccine? No. They're pulling it because they've laced it with AIDS. They're pulling it because people are getting heart attacks. There's over 100,000 of side effects of people reporting that they've had side effects. Is it a good vaccine? I don't even believe it's a vaccine. So please, whatever you decide with her, we have to have some healthy boundaries. Thank you for your time.
Sean Treadway.
Chairman Bohm, Commissioners, thank you. Just a few thoughts. From the beginning of the pandemic, we've been told to follow the science. Mask, unmask, don't congregate, social distance 10 feet, 6 feet, 3 feet, quarantine, get your vax, and you're good to go. Wait, get a booster. You'll be protected. Well, not protected, but it'll lessen the symptoms. All in all, I have to say that I'm a little conflicted with the science. But what I am not unruly, I'm not uneducated, I'm not a COVID denier. I did wear the uniform and followed orders for the gentleman speaking about a uniform that should never speak about a uniform. I'm passionate, I'm concerned, and I'm a father and a husband of this county. We came to you with various reasons. You being our elected officials, we look to you for guidance, communication, and support. We also came to you to vent. We asked you to protect our God-given rights, our rights according to the Constitution, a document that was written to be unmolested and uninterpreted. We come to you to ask for accountability, oversight, and the direct responsibility to ensure that the unelected do not make policy, nor do they mandate rules and regulations without your direct involvement. Now we see a memo that will allow directors from both the Health Department and Homeland Security, specifically named in the memo, to fire directly from the hip with communication to the county administrator, essentially providing each of you a line of defense to simply say, I didn't know that this was happening. If this goes forward, yet another unelected individual will now decide what needs to be communicated and how, decisions that affect all of us. It seems we're back to square one, yet another slippery slope. There's been a lot of comments stating that the public speaking out at the meetings is all politics. We've already heard it today. Caring about the rights of my children, my family, and my fellow citizens is not about politics. It's about the rights given to us by God as free individuals, written by our forefathers, to protect said rights. Thank you.
Liz Masters.
Thank you. My name is Liz Masters. I'm the supervisor of Wales Township. We just heard about politics. This is definitely not politics. That's what I'm going to ask each of one of you to think about with this decision. One of the first decisions, most important things that you have to decide here is doing a job. We're hearing about COVID. We're hearing strictly about COVID, a pandemic. Obviously, looking out before this room, looking at this board, none of us are not emotional. It's very hard to pull yourself away from the emotions. And I do sympathize with each one of you and with all the audience. No matter what side we choose on this, we all have emotions after 2 years. Now, what I am going to caution you is within emotion, be careful of making motions. That's usually one of the first guidelines that you have to be cautious of. I'm going to remind this board that back in January, before a very fueled audience, you confirmed that Dr. Mercantile would have been here. She had offered to be here, but you thought it may not be a good idea before a fueled audience. So she decided to stay back. You advised her to stay back. You then continued to make disciplinary plans and discuss that. In the Open Meetings Act, I'm going to caution that an employee does have a choice for closed session. I'm worried about that. I'm worried about these decisions out of emotions that are being made. motions out of emotions. You continued in open session. Essentially, that denied her her opportunity to request a closed session. Now we go to step 2. We already spoke on it. What candidate would replace these 2 positions? And I'm going to remind some of these board members are veterans and may have been on the board when she was chosen. Now, during the pandemic, what we saw at our local government offices is we saw leadership. We saw between emergency management and our health department, a teamwork, a network. That's what we need. We need to decide at our home level what we were going to do, and I'm going to advise that it doesn't take just COVID. The health department is in charge of our health, our groundwater, prenatal care, family nutrition.
15 seconds.
Family nutrition, infant development. What is your plan? Who is out of a job and who is available? What quality is out there? So I'm going to ask you, when you make these offers, to make the right choice. Think forward, and I've heard nothing of that. Thank you very much, by the way, between emergency management and our health department.
Richard Matuska? Matska.
You're almost as bad as the Chief of Naval Operations in 1969.
Remember when you were on that boat?
But he only did it once. My name is Richard Matska. Thank you for your time today. Thank you for the difficult job you have to go through. To the doctor, I am a veteran, and I was given orders, and I told him, put them in writing. They didn't want to put them in writing for what they wanted me to do. I didn't do it. Same thing I say to everybody else. If you want to end up in Nuremberg, you go ahead and do whatever the heck somebody else tells you to do. I've been threatened before. I've been to Vietnam. I've been to the Middle East. I've been to China for 40 years. I don't appreciate when someone tells me, if you don't do what I say, we'll put you in jail. You haven't got enough jails to put all the people in that would resist that action. Someone who makes an irrational statement like that causes me to believe that they are not the right person for that type of job. It's your choice. God bless you. Mr. Fletcher?
Linda Smallfield.
It's okay. You've got this.
Take your time.
3 minutes. Good afternoon. My name is Linda Smayfield. I live here in Port Huron. I'm a 67-year-old retired statistical coordinator. I don't know anything about medical doctors or political positions. I do know, however, with every conflict, there is a potential corrective action that can be done in a method that's a win-win for both sides. I read it, the reason I'm here today is because I read this in the paper, and one of the lines referenced that Dr. Mercantante's position would mean a $27,890 cost increase to the county, or rather taxpayers. And I'm thinking, for that kind of money, if the issue is all about communication, or rather lack thereof, why not use that money to fill a position as a communication coordinator? I'm here to offer solutions to an existing problem, not just complain. I support Dr. Mercantante totally. If her position needs to be divided as a result of her inability to complete both of those tasks as need be to appease everyone, then so be it. But certainly don't fire the woman. She's done a phenomenal job. It was St. Clair County Health Department, and only St. Clair County Health Department, that afforded my husband and I the ability to get vaccinated, which was our own personal choice. We both believe that it's everybody's choice. And it was done right here in this building, as a matter of fact. 3 pharmacies, including my own doctor, didn't get that done for me, but our St. Clair County Health Department did. And for that, I'm grateful. I just think jumping to the gun and getting rid of somebody's position without first trying to find a corrective action, and that might be something in writing, a specific process that one goes through that gets even audited to make sure it's being done in the right way so that everybody gets the information they need. Not casting judgment on anybody else, but I think getting rid of Dr. Mercantile would be a huge mistake for our St. Clair County residents. Thank you.
James Buckley.
Thank you. My name's James Buckley. I've been living in St. Clair County my entire life. I wasn't planning on coming today, but work got canceled, so I swung by. Pretty much, I just want to put my opinion out there. Everybody knows what everybody else is saying, and I just want to say that I think a health director should not go after people's families in any way except for giving what is asked by the family, and also to provide opportunities or services that they want to provide to the public. By putting out mandates, I think that oversteps her position. If she wants to make opinions, or if she wants to state what she thinks is great, that's fine with me. But as soon as we receive letters that say otherwise, that's where I have a problem with that. So I think that the position should be separated into 2 positions like it used to be. I think that leaves a little more opportunity to deal with each person operating each position, and that would give a better opportunity for, if we have an issue with the position, that maybe the other person could take over temporarily. That's my opinion. Thank you.
Marcy McClellan.
Thank you for allowing us to come and speak. I did run the numbers again for our 3 schools that I've been keeping track of, all during the time when we were optional masks, highly recommended mask mandate, and masks optional now again. And I just want to say that the numbers have significantly dropped. Like in Yale, we had 13 cases for the last 3 weeks, 7 cases in Algonac, and 80 cases in Port Huron area schools. And that's from their website, so I want to give you these copies for you to have for reference to keep in your, I guess, meeting notes. I also want to just say that it was very disappointing that you didn't pass the censure letter from last time. I'm thankful for the support of the ones that did agree with it. I think we had students here speaking for a month, teachers here speaking for a month on how it was not effective. The kids spoke on how it was disruptive in their classes. Kids didn't even really do it. And with her slide that she said that our students should mask because there was a 32% decrease in the month that, or the weeks before Christmas, that Algonac and Port Huron were masking. Well, according to this chart that I have from the schools, their numbers were way higher in Algonac during that time frame. So I don't know how that she can support any of her doing that. So I guess I'm just very disappointed in how that happened. I feel like that was detrimental to our young people in our county. I mean, how can you justify doing it only to a certain number of kids? And I think just for that alone, there definitely should have been something, because if it's really a bad time in our county, then it should be happening everywhere. Should be happening anywhere that you would go, a gym, whether you would go to any games or anything, but it wasn't that way. It was only to our kids. So with the final time that I have, I would like to find out, I don't know if she can comment or if we can FOIA this. I'd like to know what's happening with the money that the health department received from our state. They received $516,000 for COVID contact tracing testing. They received $836,000. So I'm really curious where that money is going to, if there's someone who could answer that.
Marcy, is that your pen?
No, that was up here.
Joseph Knopf.
Good afternoon, and thanks for all your service. I think sometimes in a leadership position, the reason, and coming from a former leadership position and also being in business, we need to look at the macro effect. Macro, probably the doctor is not familiar with that term, as there's lots of specialists today in the doctor's departments. And so we don't just rely on the micro position, speaking in economic terms, or our lives. Many times as an athletic director, people didn't always agree with me, but I did not just follow what my contract says. I looked at the whole position. The health department, kids could not see faces. Faces is important recognition of how children learn. How does that affect their health? How does it affect their health when that age group was not even a threat to their health? That little mask isn't going to help you, as some of these people have talked about. I respect the people in the audience and accept what they say, that we are working, we're in this statesman, but at this time in our culture, citing quasi, because you can look things up online, about 50% of the doctors now believe in the institution as who they serve instead of the family. Are we going that route? So we always need to look big picture to linear. Big picture to linear was not served well by this doctor and those who agree with her. They're agreeing with the state instead of what is best for the families. Follow the money, follow the conscience. Often, as a leader, I got ways to say prayers in my football huddles because I knew it was the right thing. Could have I got fired? Maybe, but that's the consequence. I had a mortgage to pay, but I chose to do the right thing. In this case, they favored their department and did not look at the whole picture of a child. God bless America, and thank you for your time and what you do to serve us. But you're statesperson first before just as Dick there. And thank you, and God bless.
Elizabeth Somerville. Sorry?
Should it wait till later?
All right. Put you on the bottom, how's that? Diane Lois?
Since we're at a safe distance, I will pull down my mask. I really felt at some point I had to, as an employee of the health department and as a citizen of the county, you know, I have rights to express my feeling, and I have to say that you're not just attacking, I'm not saying you personally, but this isn't just an individual, this is a face of an entire organization, an entire system of well-trained, dedicated, compassionate individuals. When you work at the health department, you're not just punching a ticket. It's like other similar professions that when you're at home watching the news and I do virus services, an outbreak, something that deals with public health, you pay attention. You bring it to work, we discuss it. These are the kind of people that are behind Dr. Merck. She's our leader. She's our mentor. She works with us side by side. She'll work for us. We work for her. But she is that example of what I call a true leader. It's not about control. It's not about profile. It's not about media coverage. It's about doing the right thing at the right time when we still have time to make a change. It's prevention. And prevention is the hardest thing to measure, the success. Helmets, eye, ear protection, seat belts, car alarms, smoke alarms. Do we have any idea how many lives it has saved, directly or indirectly? Public health is in that category. It's about identifying what makes us sick and taking actions as quickly as possible and put these preventions in place. And sometimes the time is short, sometimes it's a long smoking burn and we got time to think about it. But this is why she has those powers. I would entrust anything that I love or hold dear to me with Dr. Mercantile. She's true, she's honest, she's empathetic, and she's compassionate. Even people that don't understand, that disagree with us, that say terrible things, even divisive or intentional, what she says in the meeting is, help me to understand, what am I missing? How can we help people see the whole picture? People have been experiencing things in their lives, and it comes out in times like this. How can we get them focused, solve problems, and give them the information they need to take care of their family and themselves? This is her. She's true and she's honest. And I don't know what else to say, but just keep in mind that she does not make decisions in a vacuum. She has a whole team behind her. I'm one of those members of the team, and I'm so honored. I'm honored to stand behind her. And when she makes a decision, she doesn't do it arbitrarily. She talks to every single person around the table. What do you think? What do you think? Then she makes her decision. She listens. She listens to everybody.
Please finish up.
So I just, please accept my comments. And I understand, we all understand, you represent people too, and how difficult it is, but you got to do what's best for the majority in situations like this. Thank you.
Kevin Watkins.
Well, thank you. First, apologize, Jeff, for that outburst, but I felt the person who was showing the time, because you're silent, you still get your time. You can have 15 seconds of silence. You get 3 minutes. So I'm going to make sure you knew that. Quickly again, Kevin Watkins, Wells Township, citizen of Sinclair County. Mask mandates. It's interesting, I know Mr. Rushing is my rep. He covers Memphis and Wells Township, and we're definitely in both two different ends of the continuum. But one thing we both, when I say this, he always snickers because he knows I'm right. When I talk about mandates, when I talk about George Washington, and this is to that veteran who came up here also. George Washington did mandate his troops to get the smallpox vaccination, mandated. And back then, they probably put you in front of the firing squad if you refused. And guess what did they do? We have America today because of that. Because they didn't do that, if they all died from smallpox, which there were instead of bullets, what we have in America. So remember that. Sometimes mandates are important. You have some people that stand up that are just honorary and refuse to do the right thing, and you have to mandate it to save the masses. You talk about merit expertise. You know, to disrespect a person like Dr. Prakash with his international and American experience in medicine, that's what I talked about that Dr. Bombay some meetings ago. When people read the internet, think they know, have no expertise in medicine, but want to speak on his level and want us to listen to them. That, you know, we can't do that. Are we going to go back in time? We're talking about, are we going to go back in time? If we dealing with, you know, the danger of this right now is that, are we going now, these people are going to say that, oh, we're not going to get our kids vaccinated for mumps, measles, rubella, whooping cough, polio. We're going to go to that? If you guys, I remind people, please study some history. Be a little bit of a historian. Study back what happened in the early 20th century when kids were dropping like flies from measles and other communicable diseases. Kids coughing to death, whooping cough, what is that? They coughed to death, couldn't breathe, was coughing so much. It's craziness. We eradicated it with vaccines. Okay, so it was up to Dr. Mercantile to follow those rules. Those mandates that she was bringing down came from the governor's office, and then following the CDC guidelines. But then you want to strike back and bring harm upon her and her position in the health department because of that. Are you kidding me? That's their job. What would we be if we weren't wearing masks? What would we be right now if the people that are vaccinated are not vaccinated? So I'm sorry, masks work. I wear masks for you, you wear masks for me. Keep your droplets to yourself. Let's eradicate this COVID. It's never going away, but we can control it. We don't want to fear COVID, but we have to respect it. And part of respecting COVID is to wear masks and to be vaccinated. So in the pink elephant in the room here is more so is Dr. Mercantile stepping up, dealing with health disparities. That's the one thing that's not coming up that people don't want to deal with. That she's doing it. I'm gonna finish up. I got you said 15 seconds, okay? But anyway, so please keep that in mind. And also what Vicki brought up as far as the two positions, we have a person who's expert as a doctor and also has a master's and expertise in public health. We have a steal there. And so be careful what you wish for. And don't be like my pastor once said, you can't stand prosperity. We have prosperity to stick with it, please.
Kim Brown.
Chairman Bone, and to all of our commissioners, thank you for the opportunity to speak. And I come to speak today, not necessarily on behalf of any of the issues, which I probably should be speaking about the issue, right? But something that Kevin said, and I'm listening to others as they come up here and they're talking. When you talk about this particular thing, just like smallpox and other things that we've had, epidemics and health challenges, they have come, and eventually, because there was some intervention, they went away. But I want to look at the issue beyond that. Beyond that. I want to look at the personality. I want to look at the relationship that a department has to have to engage its community. And I will say that if it wasn't for Dr. Mercantile, that I believe that many of the people that are now engaging your community because of relationship probably would not be doing that. I serve a church that is in your community where the health department is. And I became concerned one day that the issues of disparity amongst especially minorities and individuals within that very community didn't seem like they were being reached. And I was glad that by relationship I could walk through a door and I could talk to a lady who had those same concerns in her heart too, and that was Dr. Mercantile. And because of some of the very innovative things that have been done recently, and thank you for that, whatever parts that you have played, people in the community that probably need the services the most are being reached. So it's not just. And so when we talk about positions, and I've watched this lately, I have not had an opportunity to really come and speak about it, but when we couldn't eliminate her position by dealing with mask mandates, then we went to censorship. It couldn't be done by censorship. Now here we are trying to divide a position that was established. The person went away, and I think it was 2009. And here we are all these years, and now it just happens to matter now.
About 15 seconds, please.
Okay, I respect that, thank you. And I'm saying the person also. I'm sure that there is a time when her time will come, that she will move on appropriately. But let her please finish her job, because it's a good one that's being done, and it's reaching your community even beyond just the majority, maybe helping those who might need the help the most. Thank you very much for your time.
Joy Torello.
Hello, Joy Torello. I'm not a very good public speaker, but I've been attending meetings, and I know we've had a lot of different opinions back and forth, and I know there's a lot of passion, and I know people are searching for the truth. The truth will always prevail. I know that to be true. Truth is that this experimental gene therapy shot that we have, my dad did the right thing. He thought he was doing the right thing. He took that March 2nd, and he was dead 2 months to the day. Thought he was doing the right thing because he thought he was following the science. But who else on the board is opposing just one opinion, that they can come to the table and just really start looking at the science and following the science? This is not a vaccine. This is gene therapy, something that's never been done before. I'm passionate about it because it affected me personally. I did call Ms. Mercanton's office, but I never got a call back. It's probably a good thing because I was a very angry person. God bless you guys, but I really hope that you do the right thing. Position or not, I don't know. You can't bring back what somebody's lost. And there's a lot of kids suffering now. There's a lot of angry parents. There's a lot of division. We need to come together and have unity in this community. She needs to be a little bit more honest, and she needs to be a little bit out there for the people, because we've been asking questions for a long time. We're still waiting. God bless you. Thanks.
Elizabeth Somerville.
Hi. Thank you very much all for being here. I just wanted to come up here and tell that I do not support keeping the position together. At some point, we realized that there was a problem and we need to come up with some kind of a solution. If during this, during COVID, brought light that there was a problem with joining the two positions together, then maybe we need to figure out what we're doing, how to break it up, how to break it apart. It's my opinion, and I just want to come up and say it. Thank you.
Okay, we're going to move on. Sorry? Oh, all right. Got to read a couple letters here.
This is from, Ken Harris, addressed to the Board of Commissioners, asked if they would share. Please let me share my Please let me share my concerns with the provocation of some and charges thrown at County Health Director. As my interest and for many of you, the internal battle of our county commissioners and driven by a number of spontaneous county residents over masks in schools and their application in this county, let me share this message from the Michigan Guide to Public Health for Local Governing Entities. Your community needs you. As a county commissioner, Board of Health, or Township City Council member, you have a legal responsibility to protect and promote the health of your community. You have an opportunity to provide vision, leadership, and policy to make your community a safer, healthier place to live. Health officer. Health officer can be a governing entity's best public health resource, assisting and answering questions from the LGE and the communities they serve. By state administrative rule, a health officer requires a specific education and training in health. Health officers have explicit authority and responsibility related to protecting public health. Examples include declaring a public health emergency due to a disease outbreak or other public health threat, notifying the public about health risks, and taking necessary legal actions that may include isolating those carrying infectious diseases, quarantining people or places when a health threat is suspected, including ill children from school, closing a restaurant, and stopping construction or habitation when unsafe public sewage disposal or drinking water conditions exist. Common health officer roles: represent and principal spokesperson for local health department, provide leadership during a public health threat or emergency, establish relationships with the key entities such as county commissioners, Board of Health, city councils, medical community, media, and the public. Our county is a safer county, not by censure, but by strong bodies at the St. Clair County Health Department. Ken Harris. Dr. John Polachek, MD. Dear members of the St. Clair County Commission, Board of Commissioners, as a physician, citizen of this community, and president of the St. Clair County Medical Society, I feel that I must reach out to the Board of Commissioners regarding the question of separation of positions of Public Health and Medical Director of St. Clair County, as well as the renewal of Dr. Annette Mercantant's employment contract. Carrie Hepting documented a detailed chronology of Dr. Mercantant's accomplishments throughout her employment with St. Clair County in a memo posted on the St. Clair County website. Prior to voting on these two vital decisions, I think that it would be very beneficial for each commissioner to read this document. To paraphrase Ms. Hepting, quote, Dr. Mercantant has been a loyal, dedicated employee of St. Clair County since 2008. During her time at the county, she has implemented and expanded numerous programs and services to meet the challenging needs of our community. She has increased communication to the Board of Health Department activities. She has significantly increased public health's community involvement, with staff participating in more than 65 different community coalitions, task force, and committees. This type of community involvement and public outreach did not exist prior to her becoming the county's medical health officer. In 2018, nearly 100 individuals representing various sectors in the community were invited to participate in the evaluation of the community health needs assessments results to formulate a community health improvement plan to help determine our greatest public health care needs. It is important to look at all of the health department's accomplishments under her leadership over the last 14 years and not base a decision solely on the communication of two decisions made during a global pandemic where everyone is working toward the same goal of keeping the community safe and returning to normalcy. Dr. Mercantant has been an exceptional and incredibly community-involved medical health officer throughout her employment, and her leadership has been pivotal in reducing morbidity and mortality in our community throughout the pandemic. I thus fully agree with Ms. Hepting's eloquent stated recommendation, and I strongly support Dr. Mercantant and the renewal of her current employment contract. I further urge board members to vote against separating the roles of public health officer and medical director. This is Marie Muller from the St. Clair County Health Department. We, as the Advisory Board of Health, strongly oppose the recommendation to separate the roles of the medical health officer and post the new positions prior to the expiration of the current contract. Dr. Mercantant is a dedicated employee and highly respected physician who has implemented and expanded numerous programs and services in our community. Highlights of this are outlined in Carrie Hepting's memo you received on February 9th, 2022. Dr. Mercantant's interaction with local physicians and hospitals has been of great value in improving the overall health of the community. We believe the recommendation to separate the medical health officer positions sends the wrong message about the dedication and service of not only Dr. Mercantile and Health Department staff, but also that of our contracted employees, and implies their services is not valued. Proceeding with this recommendation will have a negative effect and severely impact our ability for a quality health department. Separating the medical health office position should not be taken lightly. We recommend the contract with Dr. Mercantile be renewed until the succession plan can be further developed and implemented. We welcome the opportunity to speak with you on this matter or any topic. Anup Lal, MD. My name is Anup Lal, MD, and I am a physician living and working in St. Clair County since 2005. I'm writing this to strongly support the excellent work done by Dr. Mercantile as the head of the health department in helping us fight the ongoing pandemic. I am frankly appalled by the attacks launched at her, both professional and personal. Her hard work and conscientiousness has been exemplary and should be lauded. The steps taken by her are based on standard recommendations by national health organizations such as the CDC and based on good science and common sense. This is a person who is basically doing her job in the best way possible as a doctor, a health department official, and a responsible citizen. To get some perspective, it would be instructive for those who attack her to know that stricter measures are routinely imposed in multiple other counties in surge situation with case percentage lower than our county. As a physician who has seen far too many suffer and die due to COVID, I wonder if those who stridently call for the choice to unmask their children spare a thought about the workers in the school system, teachers, bus drivers, cafeteria staff, and others older with typical more health problems than younger children who are placed in harm's way, or the exhaustion of the workers in the health system facing yet another surge. It does not seem like it, unfortunately. I sincerely hope that this letter can be read in support of Dr. Mercantile at the next board meeting. I also sincerely request that she receive strong support from all those who truly care about the health of the people of St. Clair County, so that she can continue the work that she is doing for us and our fellow residents of this county. This is from H. Lee Batchelder, DO. I am providing this letter in support of Dr. Annette Mercantile and the staff of the St. Clair County Health Department. As we all are well aware, the preceding 2 years have been very challenging in our community, state, nation, and the entire globe. The SARS-CoV-2 virus pandemic has presented great challenges and losses to our community, healthcare systems, and public health systems. As the virus traversed throughout the world, the new variants emerged. Treatments along with public health measures changed as our knowledge increased, building the plane as we flew it. The local health department, under the guidance of Dr. Mercantile, provided public health recommendations, coordinated treatment programs, and maintained constant communication with healthcare providers and the greater community, convening updates on a regular basis. It has been related that there are some members of the community that have made adverse remarks regarding Dr. Mercantile and her role. She has remained steadfast in her resolve to ensure that our community has current resources and information to guide us through this challenging time. In my opinion, Dr. Mercantile has been an informative and sound resource for our community, and I wholeheartedly support and appreciate the time, effort, and passion she has given to our county in fighting the pandemic. This is from Robert and Tammy Berger of St. Clair. Good afternoon. We are writing in support of maintaining the medical health officer position as is and renewing the contract of Dr. Annette Mercantile. It is not a financially responsible decision to separate the positions out of emotion. As a Board of Commissioners, you have been trusted with a responsibility to make the best financial decisions for the citizens of this county. You should not be bullied by the emotions of a few constituents. Dr. Mercantile has had an excellent employment history with the county and continues to serve the community well, and we hope will continue to do so in the future. From Tricia Jones. I would like my comments read publicly. Unfortunately, the early scheduling of this meeting does not accommodate those of us that work during the day. Thus, we cannot be present as we otherwise would be. I certainly hope this wasn't done intentionally to exclude us from this conversation. While disappointed to see the commissioners not censor Dr. Mercantile, I understand why the majority of you voted against it. The censure was brought on a miscommunication between Dr. between the doctor, Mr. Boehm, and the rest of the board. A miscommunication is hardly reason for censure. However, the censure should have been brought on the complete overreach of authority in violation of all of your constituents' civil liberties and a violation of any oath to uphold the Constitution and/or Hippocratic oath to do no harm. And by allowing her to violate the civil liberties of the people, you all have also violated your oaths of office. There must be better checks and balances to prevent public health officials from exercising arbitrary power over public policy or decision-making, whether in times of an actual or fabricated public health emergency. No person holding a public office or appointment has the right to violate individual rights of any U.S. citizen under any circumstance. By combining the top two health department positions of director and administrator that Dr. Mercantile currently holds, you have allowed her a position ripe for that of a superiority complex and the egoism that led to this exact abuse and arbitrary exercise of power and authority. It is critical that you follow through on separating these positions and put the bids out as previously discussed. It's also critical that policy is developed and implemented to ensure that proper oversight exists so that no single individual is vested with absolute authority without accountability or liability. By following through on this is an action of good faith towards all of your constituents. For the sake of redemption and recompense, I pray you all will do the right thing. This is from, Kim Judge. I'm writing to 100% support our St. Clair County Health Department Director, Dr. Annette Mercantile. Dr. Mercantile's unwavering dedication to the public health of this county during a once-in-a-century global pandemic has been above and beyond remarkable to witness. Her job is to protect the health of the public. It is unconscionable to think a termination or censure is even a topic of discussion. Support and respect of our dedicated healthcare workers should be unwavering. They are tired, they deserve our admiration versus admonishment. Yes, it's been over 2 years we have been navigating COVID-19. Yes, we are all tired, frustrated, and some days confused on proper protocols. We may be over and done with COVID-19, but I do not feel COVID-19 is done with us. Wearing a mask for the safety and well-being for myself and others is a very small price to pay. Thank you, Dr. Mercantile and staff, for your exemplary dedication to the health and well-being of St. Clair County residents. You must be exhausted, and I thank you for your service. This is, well, it almost looks like there's two of them from the same person. And we're only going to read one. Yeah. Good, I'm sorry. This is from Laura Jean Troy. Good afternoon. This letter is to discourage splitting Dr. Annette Mercantile's position at St. Clair County Health Department as Public Health Director and Public Health Physician. Please read my letter of support to renew her contract at the St. Clair County Board of Commissioners meeting. I have been a lifelong resident in St. Clair County. Besides being a retired special education teacher, I have worked as a public health nurse for St. Clair County. While I work at the health department, this position was filled by a full-time public health director and part-time physician, which oversaw 3 counties. Prior to my career as a public health nurse, I was the infectious control practitioner at what was called Port Huron Hospital. In that position, I worked closely with the health department during the HIV, AIDS, and tuberculosis crisis. So I have a thorough understanding of how important public health policy are to keep our community safe. I feel that we are very fortunate as a county to have a physician who also fulfills the role of public health director to oversee our county's public health policies regarding this pandemic. I could not imagine the disconnection that could have happened if our public health physician was only accessible to our county on a part-time basis. With her education experience, Dr. Mercantile is highly qualified for this position. With a shortage of medical staff, I can only imagine how difficult it would be for our county to replace a person of Dr. Mercantile's caliber and dedication to our county. She and her staff worked 24/7 to ensure that lives were saved and public health policies were implemented. Dr. Mercantile did a commendable job keeping our community informed during this pandemic with a novel virus. Even though we are exhausted and done with this virus is not done with us. The pandemic is not simply over because we make that decision. Our citizens, as citizens, we can learn to live with the virus using mitigation strategies based on science, which are recommended by our public health department, not political outcry. This is not the time to cut back on our resources available to us. Dr. Mercantile is a valuable resource in which our county is one of 2 counties in our state that has the expertise in public health, along with being a highly qualified physician. Subcontracting a physician from a neighboring county would be a disservice to Sinclair County because the other counties do not have the same demographics and needs. Plus, our Board of Commissioners and Public Health Director would only have part-time access to a physician during a global crisis such as the COVID-19 pandemic. It's important not to lose our resources during a pandemic in which this terrible virus, which has caused so many unnecessary deaths, just because we want to be done with this virus. Dr. Mercantile's primary responsibility is the administration of the health department with authority and responsibility to protect health, prevent disease and disability, and further improve the public health. Dr. Mercantile fulfilled these responsibilities, and I highly encourage the Board of Commissioners to vote to renew her contract. Splitting this position would cause an increased financial burden to the taxpayers, let alone the possibility of the vacancy resulting in a shutdown of the health department until the position is filled based on state approval. This is not the time to have a public health shutdown. I do not believe any of our Board of Commissioners have a medical degree and rely on the expertise of public health department to establish policies to keep citizens safe. Did Mary Powell speak? Did Mary Powell speak? No. This is from Mary Powell. While I was unable to attend the last meeting, I was watching live. I just have a few remarks. Words that I keep hearing were selfish, uneducated, loud, obnoxious, uninformed bullies. These are words that the supporters of our fair doctor were saying about us patriots. We have had supporters attack people in public for not wearing a mask, and I recall one nurse making threats towards our commissioners. Well, the only threat that we have stated in that is that your seat is not safe, but we are the problem because we do our research, because we have read our Constitution, and because we have made very educated decisions on our own for the health and well-being of ourselves and our family. You do not have to have a bunch of letters after your name to do research and make informed decisions on your own. People do this every day in their lives. How else would the common person survive? Dr. Mercantile said that we need to move through this as a community. What does that mean? That everyone is supposed to agree with her and her supporters and sit down and shut up? No, thank you. I still live in America, and where it is still the land of the free, I am still legally able to make choices for myself and my family. While I take all recommendations at heart, I do not have to follow those recommendations. Well, at the start of this pandemic 2 years ago, there was a lot of questions and unknown. We did turn to doctors, scientists, and our elected officials to guide us. There is now a lot of science out there that allows people to make their own choices in their lives. It is no longer, I wear my mask for you. Why? Because science is showing that the only person protected by wearing a mask is the mask wearer. So if you want to wear one, wear it, please. You are free to make your own choices. Cloth masks do not work. Lockdowns did not work. The mRNA shot is not as effective as we were led to believe. While it may protect those who receive it, it does not protect anyone else, because a vaccinated person can still catch, carry, and transmit the virus. I know this personally, and finally, society is in trouble. If there are so many uneducated individuals out there that they may rely on the government to mandate things or only listen to one doctor's opinion, then we are in trouble. People are always going to disagree. You should not be verbally attacking those who do not agree with you. This is called being civil. The last 2 years have broken up families, friends, businesses, and much more. We must stop the madness. I remember when you could smile at another person and not have to worry about being verbally attacked because you don't have a mask on. Science is forever changing, and people need to make their own health choices. We are not anti-maskers or anti-vaccines. We are pro-choice, and as the recent weeks have shown, this was all not about a virus. It is about control. Suddenly, blue states are pulling their mandates. Why? The virus didn't go away. Oh, that's right. It's an election year.
Please finish up there.
Now, as for not censoring Dr. Mercantile is a large disappointment. She did not state, not in exact words, that she would not follow a communication plan. Sadly, because of her title, it seems as if she feels rules do not apply to her, and by not receiving a censure because she had a well-scripted speech, she is now free to do whatever she feels to the citizens of St. Clair County. This is from Sushma Reddy. As a physician and a concerned citizen actively involved in our community, I strongly oppose the recommendation to separate the positions of medical health officer excuse me, and medical director and post new positions prior to the expiration of the current contract. Dr. Mercantile is an outstanding, dedicated, and highly respected physician, passionate about improving the health of our community. She is actively involved in our medical society, both locally and at the state level, and has built close relationships with local hospitals, physicians, and community leaders. These relationships have been crucial in improving the health of the community. I strongly feel that this recommendation to separate the positions of medical health officer will also have a negative impact on our health department and other contracted county employees, creating a feeling of mistrust and loss of value. This will severely affect our ability to have a quality health department and recruit qualified individuals. I respectfully request that the contract with Dr. Mercantile be renewed. Excuse me. This is from Carolyn and Steve Richards. Since we cannot be there in person, we have written the emails and requested that they be read to the Board of Commissioners at this evening's meeting. Part one from Carolyn Richards of St. Clair County. I want to express my disappointment with how you have mishandled the actions of the Health Department Director over the past several months, not once but twice. She has put out a public health order with little communication to the Board of Commissioners and with little to no direct data to justify a public health order that primarily targets schools. First was the quarantine and contact tracing order, which threatened families of the counties with removal of their children, imprisonment, and fines, which you stated was never meant to be followed through. Last fall, you all agreed upon a resolution making mandates of masks and vaccines. Let me start that again. Last fall, you all agreed upon a resolution against mandates of masks and vaccines. You as a board also sent a letter to Dr. Mercantile requesting her to rescind the public health order of quarantines. She disregarded both of these and continued with her unilateral, tyrannical mandates, focused only on our least vulnerable population. The only time she rescinded her order is when her funding was threatened by the state. Both times her position was rumored to be questioned and threatened termination. Dr. Mercantile packed the house, so to speak. The first time was in person with several speaking on her behalf. One gentleman that spoke on her behalf publicly threatened the community if the board followed through with the rumored motion to terminate Dr. Mercantile. The same gentleman disrupted another recent meeting by demanding additional time that he was not yielded. Yet we are called the mob. Then this last meeting, several letters were written and read on the doctor's behalf, and I must point out that many of these letters included very similar wording. Oddly enough, almost as if they were coached. But with the observation aside, there were numerous written letters, but where have these people been for the past 6 months? Do these people have children in school, children at home learning, struggling, children suffering from mental health issues, children having medical issues because of the constant facial mask? If they did, they would have been attending these meetings all along, standing beside us with the same concern. We parents and citizens have been packing the house, speaking, presenting solid data, studies, information, some of it through FOIA requests from St. Clair County and the state itself, yet all of it has been disregarded time after time. If the people who wrote those emails on behalf of Dr. Mercantile, and this goes for the board as well, had actually listened to all of the data that had been presented by us, took the time to check the sources, look at the studies and data, you would see that we are not gathering our research from Facebook, as one letter stated. We are not bullies, we are not a mob, and we were referred to as we were referred to, and we are far from uneducated. We are parents, we are citizens with unalienable rights, and for many of us, we will soon be public officials, possibly replacing your seat, and these are our children. Thank you. So that's one, Dave, so I'm gonna go to the other one.
Okay.
This is from Stephen Richards. Per Dr. Mercantile's contract that I will remind you will be up for renewal or replacement June 30, 2022. It states that there will be an annual performance evaluation. However, when her annual performance evaluation from 2018 through 2021 were requested through FOIA, there were no documents available. So no annual performance evaluation. I've also discovered through my research that there is a Sinclair County Health Advisory Board that also oversees or is supposed to oversee the health department. This board was created in 1942 and made up of 5 members, six members including the health officer, which is also Dr. Mercantile, considering she holds this position as well. These members are to be appointed for a term of 2 years, made up of community members, and only one is a medical professional, and they are compensated. So with a little bit of digging, we were able to find the Health Advisory Board. Marie Mueller has been a member since 1998. John Jones, member since 2010. Monica Standell, member since 2015. Arnold Kuntz, member since 2016. Lisa Beeden since 2021. And most recently, Dr. Shushma Reddy, appointed 1 of 2022. These terms seem to be longer than 2 years. This board is supposed to meet monthly and submit their minutes to the county administrator. I have FOIA'd the minutes, so we will see what I receive. Dr. Mercantile is unilaterally running this county. As many stores, stadiums, buildings, venues, etc. have been packed full, maskless, she pushed masks on her children. Did any of you notice that the data she presented to show proof that the masks work? She used her own predicted number of cases. Really? This is the data she is going by? A number that she pulls out of God knows where that happens to be higher than the masks are optional month. Yet we had a parent contact several school districts for actual case numbers, showing the cases were higher in the schools after masks were mandated than before. What we asked you as an elected board is to hold her actions in insubordination accountable. You are the overseeing committee. What you just proved to us is money and power from these local oligarchs held more weight over your head than the public, whose children who have been affected. I hope you separate the position of health director and health officer at the very least, but ultimately post her position to obtain other candidates to fill her position once her contract is up June 30th, 2022. This is from Julie Wessel. Since I am unable to attend tonight's meeting in person due to the time change, I thank you for allowing me to share my concerns regarding the actions of the public health officer and medical director over the past 2 years in this manner. I am disappointed and extremely frustrated at Dr. Mercantile's continuous refusal to provide any data to support the mandate she puts in place, or to give any consideration whatsoever to the vast amount of data that has been presented to her, as well as the board, by the concerned citizens of this county. At the February 3rd meeting, several of Mercantile supporters repeatedly stated that wearing masks is a small convenience that we must endure in order to protect the world from COVID, if only that was true. Wearing a mask is not a small convenience, nor does it protect anyone from any virus, especially COVID. Thanks to all the doctors who spoke out to defend Mercantile's actions. I now have a very long list of doctors in this county who are either politically corrupt, willfully ignorant, or both. Whichever they are, I know who me and my family will not be going to for medical care. Mercantile has refused to look at any of the several peer-reviewed studies that prove that masks are dangerous to the wearer. At a previous meeting, a citizen demonstrated in person how quickly a person's CO2 levels rise when wearing a mask. The science has already established that breathing in high concentrations of CO2 is dangerous. Still, Mercantile has continued to push mask wearing by everyone, and forced it upon our children for an entire school year last year, and then again for 4 weeks last month. Do you, the board, not see this as concerning in any way? At a board meeting this fall, I suggested holding a public discussion with professionals who are credentialed to advise on protecting the public health against all sorts of pathogens, including aerosolized viruses such as COVID. If Mercantile and her team will not take it upon themselves to review the data presented to them, perhaps they could learn from a one-on-one discussion. The public could learn the facts as well. I didn't expect that this would happen, and it didn't. That says a lot about how much the leaders of this county want to stop this stupidity. It shows a willingness to remain ignorant
on the part of the board as well as Mercantile. Perhaps you don't see it this way, but the public does. Why would anyone, especially leadership, want to remain ignorant on something that has negatively affected every single person in this county on such a large scale and sharply divided us as well? It's something to think about. Mercantile's refusal to consider any data from nationally recognized virologists and epidemiologists to effectively fight COVID is why I disagree with Carrie Hepting's recommendation to automatically renew Mercantile's contract. We want whoever holds the public health officer and medical director's position to willingly consider all of the data that pertains to a public health situation, not just be a yes man to the dictates of the MDHHS. We want a doctor who will use their medical knowledge and experience to call out the truth, even if it contradicts the prevailing narrative. That's it.
Okay, we're going to take the 5-minute bathroom break. Got everybody?
You waiting for somebody?
I just told everybody 5 minutes, so fire back up.
Give me 20 seconds.
Yeah.
Want to talk, Nancy?
Okay, we're gonna call this back to order. No unfinished business, back up. 11A, item, public health officer position. Carrie, would you like to chit-chat a little bit about this, and you have?
Well, I believe you have everything on the agenda. You have the recommendation of the Position Review Committee. You have administration's recommendation, and then you have information that was in the binder regarding the statute, the positions, as well as information I received from the local health department liaison at the state of Michigan on how those positions are filled. I can certainly speak to the one position, the combined position. I do address it in my memo. I reached out to the state to ask about that. Basically, if you read the statute and the administrative rule, you can have a medical health officer, which is where you have a doctor, that is your public health officer. If your public health officer is not a doctor, then you have to have two positions. I spoke extensively with the representative at the state on the medical director position, the ability to fill it, as well as the ability to contract with neighboring counties. They did indicate that contracting with Macomb would not be an option for us because their population is already so large that they would not be able to serve our population as well, and the state would not approve that. If we go to the north and the west, they all have, that individual is already covering 8 counties. They're covering the Thumb, Lapeer County, and then up farther north, I believe it's District 2, which is a 4-county health department, a population of about 280,000 people. You know, would that be approved? I did not ask her that question, so that I don't know, but it would be an individual that's already covering 8 counties, so there would probably, with a large geographic area, so time-wise and the amount of time and service our county would get would certainly be greatly reduced over a combined position that we have now, where we have somebody there every day.
Okay. Very thorough, extremely thorough. Read through it a couple times when I was working out. I was actually here when we had both positions previous. It worked quite well at the time, wasn't an issue. I think what really drove a lot of this when this was a 08, 09 timeframe when we were like, you know, in really bad shape. So we were looking at anything and everything to try to save money. Probably have removed roughly 100 people out of this organization through attrition. You know, those were a lot of the driving mechanisms at that time. I've been dealing with the net for 13 years and never had issue with any of the budgetary, you know, so on and so forth. Always thought that was really well done. So just I'm kind of in the two-position deal. 2 counties out of 54, if I'm not mistaken, do what we do. We're one of the 2. Is that correct?
We are one of the 2. According to the state, there is a 3rd county going to that model. And I believe it was around 2012 that the state changed the administrative rules on the positions, allowing counties for greater flexibility just due to the difficulty recruiting people that meet the qualifications for a medical health officer. For the physician piece, it's not just a doctor. The doctor has to be board certified in very specific things of public health or preventative medicine, or they have to have an MPH. So not just any doctor qualifies for that position, and there's very specific requirements for the public health officer as well. She did indicate prior to that it was the common model that most counties had, but difficulty recruiting is more what caused the split in many counties.
We could look at splitting these positions, and obviously, Annette could apply for both of those positions, too. We're not saying that this, to me, is not that we are, quote-unquote, firing her, right? I'm just, some dialogue, conversation, so jump in there, guys. The review committee, you guys spent, Lisa, you two, you guys spent quite a bit of time on this.
Of course, the recommendation that was given to everybody is on a 2-to-1 vote that we do separate the two positions. So that's what the committee came up with, and that's what was forwarded to everybody here. Do we need a motion first before we continue discussion?
I think we can just discuss it. Conversation.
What would be proper, Jay?
Really, you got an item on an agenda that you're supposed to open it up with a position one way or the other. If there's no motion, there's no activity. So,
okay, I'm going to make a motion to have the position separated into two positions.
Support.
Okay, discussion now.
And I've got a lot of discussion in whatever order we want to go in.
Yeah, jump in.
All of this started last summer in regards to the quarantine. And there was a lot of citizens that came to our board then, hundreds of them, that were not in support of the quarantine. Dr. Mercantile took the position that she was not going to enforce it. I believe that if you're going to put a mandate in place, you have to be an enforcing agent. What happened after that is that the state came out with funding on the bill, whatever it was called, the last bill that was put funding out to all the counties in the state, that she would be losing $573,000 if she kept the mandate in place. We were told by our corporate counsel that if she did, she was doing her statutory duty and that she could not be removed from her position for doing her statutory duty. But then once the $573,000 was going to be taken away from her, the quarantine was removed. So I think there's two different things there. I don't think she was no longer doing her statutory duty, if that's what the original quarantine order was. And she did, again, she had no intent to enforce. I'll go on to the 54 out of 56. That means that 96% of the health departments within the state of Michigan, covering all 83 counties, 96% have the other model. They don't have our model. There's a specific reason for that. I think we're in the minority, and I don't think we're doing it right. We have an excess of 22,000 students within the St. Clair County. This mask mandate was put in place, and I didn't receive any information until about 2 hours prior. We have been given a format for each superintendent and everybody that she talked to. Some of those were 1 minute and 2 minute conversations. I do not believe that a superintendent, I know I would have talked for more than a minute, that they were in support of this mask mandate. She was told that she would give us communication prior to this mandate. And there was a miscommunication between Lisa and I. When I mentioned in the last meeting, it had to do with the meeting in Carrie Hepning's office, where she stated that she knew for 3 months that she may put a mask mandate in place. If that's the case, she could have given everybody a heads up on the format of what would have taken place, but she didn't do that. She chose not to. In addition, what happened is now that we had a potential censure come up, or hold her accountable for her decisions, at that point, now we started getting all these letters from doctors and people that financially are benefiting from her decisions. I wish she would have given us those kind of considerations. All the people that are here supporting her tonight, I wish she would have given us that consideration prior to doing this. All the schools, all the superintendents, all the county commissioners. She works for the county first. She doesn't work for herself. And she had all this information. She could have given it to us. But now that we potentially may hit her financially with separating the two positions, again, she has a lot of support here that wants to say she needs to keep holding both positions. I think she should have given us all that consideration prior to. I think if the mask mandate would have had monies tied to it, it never would have been put in place for the same reason that the censure or the quarantine was removed for the $573,000. There was no financial worries about the mask mandate. If there was, I don't think she ever would have put it in place. She also stated that she wouldn't do that, enforce that, and Gary can verify this once again, but the schools have no statutory duty by the state constitution to do any enforcement. They cannot do misdemeanors. They cannot do any fining. They do have the authority to put in potentially a verbal warning. They already had that, which we put in our resolution for all the schools to leave it up to each individual school district as they deemed. And they do work with the health department. They have health officers at every single school district. They could have already done that without this mask mandate. Again, I'll say they had no authority to enforce the mandate, and she said she wouldn't enforce it. This did a lot of damage to a lot of kids that they will live the rest of their lives because of this decision. This is my opinion. And I talked to the president of the Yale School District. There was 10 infected kids in Yale School. 50 were removed. The parents decided, no, my kids are not going to wear masks. They took them home. In many school districts, they can still have the same classes, but they have to do it virtual. But they're not part of the school. That's going to do damage to them, I believe, forever. And I think it deteriorated the education for all our school children for this past year and over the past 2 years. And this is damage that will never be corrected on current school kids. And I could ramble some more, but that's initial.
I just want to, in defense of her, she did what I told her. So on that, I've been very open about that on the email. She contacted me. How do I contact commissioners? I'm the one that told her to email, so she did work under my direction, so fault me for that one.
Dave, with the split position, do you think it would prevent a health order from happening?
Well, everything is hypothetical on what potentially can happen. I think with the 16 hours minimum, that to take the position that nobody's going to apply for it. Well, I think we need to find that out as county commissioners. Maybe there's lots of people out there. There might be 30 applicants for $100,000 to do 16 hours of work a week. I think that would be very open. Then you also have a position where it's a full-time position, 40 hours a week, and that's another $100,000 for easy math. It's slightly more. But when you have one person doing two jobs, I don't know how many hours Dr. Mercantant comes in, because of course she doesn't punch a clock. But if it is 40 hours, one of the two positions, I believe, is being damaged from that. And also you don't have two opinions on how to run the county. That's why I believe 96% of the counties do it that way. You have two people working together, and then you have two qualified people, hopefully, that you have qualified in all those 54 that are working together. Okay, let's talk about this. When you have one person, they're single focused. I can go to Lisa Beeden. When she serves on the advisory health department, Dr. Mercantant, in regards to the face mandate, didn't even contact her and bring it up before the health board, advisory board, what she was going to do. So that's exactly what the health advisory board is, I believe, should be doing. But they weren't even considered. So I think it's an issue that needs and has to be corrected. If nothing else, let's get the information to see if there's people that are qualified out there. We might find out that there isn't, that has been suggested. We might find out that a lot of people are qualified and do want those positions. And we do have the contract coming up in June. We're going to be addressing it there, whoever's in that position. So we need to get this started if we're going to do it. Because like Kerry Hepping said, bare minimum, it's 30 days. If we do get anybody qualified for it, it's bare minimum 30-day window from the state of Michigan.
That's for an approval process.
That's correct. That's for the approval process. The state does need to review the credentials of each candidate to determine if they are qualified, because I did specifically ask about some of that, and they said they review the credentials and let us know if they're qualified, and if they're not, why they are not.
And that doesn't even consider the posting time, posting a job, which is minimum 3 weeks just to post the job and accept applications and start the interview process.
So how is this not just a termination?
I couldn't hear you.
How is this not just a termination then?
How is it not a determination?
Not a termination.
Termination?
Yeah.
Well, she can easily apply for both positions, so it's not a termination. I mean, very well, it comes toward this board, and then we'll say, okay, the best option for St. Clair County is to maintain where we're currently at. We still got that option. If nobody else applies and she applies for both of them, if that's, maybe it'll end up being the only option, maybe it won't. But she is an at-will employee, so anybody can be terminated at any time.
Mm-hmm. Oh, no, I get that. It wasn't presented as a termination. It was presented as a post the position before the contract expires. So that's my question.
Right. Well, we could easily put, there's a lot of parameters you could put in that, find out the qualified people. It could be potentially at the date at the end of her current contract in June. And if there's any potential repercussion, I talked to Gary on this also, any suit that could potentially be brought against the county has the option to pay that salary until the end of June anyways. And then you're easy, done no harm. That's kind of, and I'm not sure if I got the right terminology, Gary, but if you've done no harm, you really can't sue.
Gary, did you want to?
I just want to speak to, the county has numerous contract employees. I believe the practice of making an employee reapply for their position is not proper, and I don't believe it's something that the county should do. You know, if whatever decision the board makes on this, it's their decision. However, you know, I think that's going to cause a lot of anxiety with employees. I know many of them have reached out to me, you know, am I going to need to reapply for my job the next time my contract is up? So, you know, if that is the precedent the board's going to set, then perhaps when we post these positions, that individual should know they may need to reapply every contract term as well.
But we're talking about splitting the position back into two, right? So this is not, we are not going out for one position. This is looking to go back to two positions.
But even in a reorganization, the county never, when we're reorging or redefining roles, and there's an existing employee there, the county does not make them reapply. We've never done that with any of our other positions. It's not part of our normal process. I mean, certainly you guys can do whatever you want, but this is significantly different from how contract employees have been historically handled, and as well as reorganizations.
You brought that up when we had the meeting with the committee in your office, and I thought about it, and I think that's a very good and excellent point on exactly why we should do this. That we're only here because of Dr. Mercantant's actions. That's why we're here. That's why everybody that's been coming to all these meetings are here. We wouldn't be here if not for that, and that's why we're addressing this now. And we all have different paths, and I'll bring up the railroad. When I track supervisor, I had 54 employees under me. And I think any employee that is not doing their job should be worried about keeping their job. I think that's what you're supposed to do. If somebody's not doing their job, if we're going to take the position, well, we don't want to have them worried about losing their job, so we're not even going to address it. That's kind of what you're saying now. If somebody's not doing their job, fulfilling their job, we need to correct it. And if that's separating the positions, if it's one of your department heads, I know how I run my business. I got fantastic employees. But if somebody's not doing their job, it should be taken care of.
But that's not reposting a position. If someone's not doing their job, there's a way that's taken care of, and it's not this way. That's not how the county has historically handled employees.
And
So-
her position is very specific, it's very qualified, and it requires the state of Michigan to verify their qualifications. So she isn't going to be like a normal department head, like somebody that takes care of the buildings, or the janitorial service, or your human resources. This is very specific, and it needs state verification for the qualifications. I'm not sure if there's any others within the state that does that. So if you can give me another example where the state needs our approval for a position, please, I need to know that also.
The equalization director.
I'm sorry, what?
The equalization director.
Okay. Yeah, they have to be certified. Yep. Thank you. Same thing with assessors. Yep.
Anyone else?
Yeah, I think, so I represent District 2, and there are people in this room who are District 2. I think District 2, that's kind of where I hone in on. So anytime I make any kind of vote, it's to represent the people who elect me, which may sometimes differ from other districts. I've spoken with an awful lot of people from my district, and I think I have plenty who have very serious concerns that I've listened to and that I've taken to Dr. Mercantant, and I've talked to many others who feel like maybe Dr. Mercantant could have done more in the way of mandates, and that's so that I'm speaking from my district. Okay. So I think regardless of how I feel about something, it's important that I look to the majority of District 2. And some of the things that I'm hearing is that while maybe some of the communication could have been better, if the intent was always to make the right decision at the time with the information that was provided, I believe that was done. And I think with the benefit of hindsight, it's easy to question some of these things as new information comes out, and we had to make different decisions. Dr. Mercantant and her team had to make different decisions with new information. I think that was done. I think the damage in that, and this isn't just St. Clair County, this isn't just the state of Michigan, this is everywhere, is it created a tremendous amount of distrust in the science or information that was coming out. I feel like this is, were it not for even if it were not for even just the mandate part, I don't know that there were complaints about the handling when it was education and it was providing opportunities for vaccine and things like that. It was the pushing out of the info. It seems to me that the problem came when it was mandates, and I'm not a fan of mandates either. They hurt my business. I see in the school, I have 3 children in the school district. I see it very personally as well. So mandates have not been something that I've been a real proponent of, but I'm not sure that at the time the intent was anything but maybe keeping kids in school and not going virtual. I do question conversations that happen. Now, I know there are districts who are very much against it behind closed doors and out front. I spoke to them too, especially Yale. I spoke with both the superintendent and the president of the board. I don't know what those conversations were like behind closed doors past that, because I think the common goal then was to keep in-person learning and try and avoid virtual. And at the time, it seemed like the masks were a way to do that. So I guess, I feel like I failed tremendously by not reaching out to a department who was solely responsible to handle a global pandemic. I didn't build a relationship. This board, we're really good at patting ourselves on the back for saying we collaborate and we build relationships so that people understand where we're coming from. And there's a part of me that wonders, had I done that even 6 months ago after the quarantine mandate, would different decisions have been made? And of course, I don't know, because we don't have the benefit of that kind of hindsight. But had those relationships been made, would we have been at a different table and maybe different decisions would be made along the way? I feel like I've created a relationship just in the last 6 weeks with Dr. Mercantant so that I can understand where she and her department are coming from. She can understand where we are, because we represent both sides. I don't get to pick who I represent, right? I listen to both, I hear both, and then have to try and figure out who's the majority and vote that way. And I don't know that everyone has always had that amount of information. So I feel like there was a huge failure, and moving forward, whether it's Dr. Mercantant or some other doctor, I hope that we do better at building a relationship so that there's open communication, so when there's a department who is drowning in 2 years of division and anger and hearing from both sides and in all of it that came with this pandemic, dealing with the mental health issues that are going to come from here, that we do better at making sure that we are all clear about expectations and how we want to operate as a team, because ultimately, all of us are responsible for the county. So that's my take on it.
On that issue, I think if we had 2 people, have 2 positions, that would greatly assist in the communications. Rather than one person making the decisions, whether decide to or not decide to inform people. Two people, I think, would definitely say, you know, we need to talk to people. So I think there's that. You say, and we all represent who put us in office. I'm getting 15 to 1. That's what I'm getting, 15 to 1, not in favor of Dr. Mercantile.
I understand.
And
That's
we're
why I
all
brought
getting
that up.
lots and lots of phone calls. We're getting hateful phone calls, and I'm sure Dr. Mercantile is, and it's a shame that we get those. It's fine to have difference of opinions and base your opinions on what you believe. And when we get done, but this stuff on the, and I'll just use right and left, but the far left and the far right, where all this hate is coming from, that's pretty hateful. So, and it bothers me.
But Dave, I've got one point. The one position is still going to make the health order. It's still one person. It doesn't matter if there's two positions, which I do believe in, but that one person will still be making the health order. Eventually, you know, it's still
Granted by the state.
It's still poorly written by the state, and with the environment in Lansing, we aren't going to get any change of any consequence in the next probably 20 years, knowing the state of Michigan, how well that's working there. So, and I even had asked Gary Ising if there's stuff coming down the pipe to reorganize the health, and it doesn't look like it, so nothing they'll get through anyway.
Well, with that section that gives the authority to one person who's supposed to be completely unencumbered by harassment or intimidation to make a decision, what that brings, if you agree with the health orders, then that's great. It's just one person and no one can fight it. If you don't, there's no appeal process.
No.
And that person isn't protected as we're seeing. So if you agree with it being written by one person, then that person is also kind of making that decision in a silo and has no backup. There's no mechanism in the state law for backup or for a board or, three professionals that have to make that call. And that's, I don't think it should matter what side of it you're on. I think that by itself should be scary. I mean, I think that's whether you agree with it, what's happening right now, know in the future, one person. So, but that's not at this table.
Right. It's way above.
Different city, different set of steps.
Different pay grade too.
Anyone else? Greg, Lisa?
I've said from the beginning that I thought that this was an employer-employee issue, and the fact that it's escalated the way that it has is disheartening for me as someone who manages people in a different industry and as someone who cares for the people that take care of our county. As an employee, I would hate to have my judgment questioned. If you know me, you know that I don't like that, but it's part of being a human and being a leader, right? But to have it done in such a public way, I think a lot of this could have been handled with hindsight differently. I think there are some things moving forward, as Georgia brought up, that we need to be better at. Certainly, I have developed a better relationship with Dr. Mercantile and been intentional about that, and I hope that others are intentional about building a relationship. Sitting on the Advisory Board of Health Committee, I have been intentional with my conversations with that committee and how we need to be more engaged and more educated, and I think we've seen a remarkable difference even from the January meeting to the February meeting, being all back on one page. And so I think it's about being intentional with our actions. I think if we split the position today, I think we're sending a very clear message to the employees of the county that contracted or not, you're dispensable. And while I recognize we're all a cog in the wheel and we can be interchanged, we're also human and deserve to be treated with dignity and respect. And as leaders, it's our job to be accountable to that. And so having this conversation now and having this conversation ahead of any sort of expiration of contract or termination of contract, I think is inappropriate and not a a precedent that I want to set for our county. I think we can be better.
What if we had I'm just concerned, I know, right, you might get 300 people sign up for this job. I don't see that. That's the biggest concern everybody has is getting employees. So I don't foresee that we're gonna be, what county is it? Oakland County's been 5 months and they haven't got an applicant?
Oakland County has reposted 3 times for their position. In speaking with the state, she said all counties are having difficulty recruiting, which is why you're seeing especially medical directors handling so many counties. If you look like to the north, like the UP, there is one medical director that's currently handling 23 counties. Because they're all, and it's temporary, but they're all trying to find someone, because those credentials, the public health or the board certification in public health or preventative medicine are not common. I also asked her if there was a database where you could search who has these credentials, and she showed me a few websites, the association of the board certification associations, and just putting in, our zip code, there was none in St. Clair County that belonged to those organizations, and only 17 within a 50 to 100 mile radius. So, certainly they could exist and they just don't belong to the organization. I'm not saying they don't, but the different resources she gave me did not find many with those board certifications. As far as the MPH, during the conference call, she indicated that doctors that go through that program, the largest program in the state, only turns out 5 graduates a year. So it's not a popular thing that many doctors are doing right now. So, how many exist? I can only speak to what she told me and the difficulties other counties are having.
Oakland County has about 2 million residents, doesn't it?
Why, yeah.
That's what? Almost 14 times the size of us.
Well, I think to your point too, if we did look at splitting this position, and if you didn't get anybody, right? And I hate to say it like that because I think they have an opportunity to reapply. I don't necessarily know. You say it sets bad precedent. I guess I got mixed emotions about that. To your point, if there's 96% of the other counties, which I have spoke to some of the other county executives, other places, and just, I don't know.
Just to add, I don't know that it's a fair comparison to say there aren't very many, because if it's based on qualifications and not having enough qualified people, it could just be, it's that simple. There aren't qualified people to handle both positions together, which is why it was amended to allow for 2. Anyway, so just, from an apples and oranges, I'm not sure that.
Hey, our medical examiner is a great example.
Right.
You don't go to the yellow pages and find the medical examiners. It doesn't happen, so.
And this could be, a trend that more counties would go to. We may have been ahead of the curve, which is hard to believe, but we may have been ahead of the curve by combining the 2, so.
Right. Carrie, if you get applicants, do you then send the applicants' information in to get vetted, or do you first pick somebody and then say, oh, you don't qualify, and then go back and repick?
So I believe some of them, it might be easy to tell whether they're qualified or not based on degrees and some credentials, but there were certain items in there where it called for public health experience, and I did ask, what is public health experience? Does that mean they have to specifically work at a health department? If someone works at a hospital and a practice, what counts? And I think that's the piece that she said is very difficult, because it could be someone in private practice, but they had to work administering public health programs and doing certain things within there. So I think that might be difficult for us to weed through. So in those instances, she said they have people that it's basically their job to go through those credentials, and they will review them and then tell you if they're qualified, and if they're not, what experience or credentials they're lacking in order to become qualified.
What does that process look like? And when I look through your notes, I think it was somebody from the Board of Commissioners, somebody from the Health Administration. There was a hiring committee that was put together. Is that?
That's
okay.
correct. As part of the plan of organization that the health department does, as part of their accreditation, there is an approved process in there for refilling the positions. And that included that hiring committee that had 3 individuals on it, and then other individuals possibly from the department or human resources also assisted.
I think it's a necessary task that we need to do in the best interest to see what is out there, to find out how we can protect St. Clair County as county commissioners. So I think it's a good practice to go through. We may very well end up right where we're at, and Dr. Mercantant ends up being the best candidate for both positions if that's what she chose. And I guess that was written in the paper today that she would apply for both.
Are most of our contracted employees, everybody have the same dates?
No, each has different contracts, different dates depending on their role.
So what if we said that we'd like to have to split the position on January 1st? So it gave us time to actually go through this process. I just don't see, if we're looking at June and we're already to the end of February, and you have to go out to, right, and it's a 30-day notice then to send to the state to just find out. I mean, we're going to push back on June as it is anyways. I don't think, and that's assuming that we get the qualified people that come in and give us the response right away, and we can get through. I mean, we got to pick the committee that's going to do the, I don't see us getting from today in hiring by June.
So my question is, the contract being, expiring, is there an extension provision in that to address what Greg's talking about, to give yourself ample amount of time? And I agree with you, by the time you have to post, by the time you have to get approval from the state, there's 2 months wiped out right there. Correct?
Right, that takes us, that's March and April, so now you're to May and you haven't interviewed.
So there is not that provision currently in the contract, so that would be, if that's something the board is interested in, a discussion I could have with Dr. Mercantant to see if she would want to stay on for another 6 months, knowing that the board is looking to post her positions, or, that's a conversation we have not had yet, so I don't want to speak for her.
Was there any consideration given to putting out some kind of RFP that had all of the potential positions? So as a full-time, as one person, or as a split position?
I myself, as motion, I think it should be a split position. 96% of the state is doing it that way, and there's a reason they're doing it that way. I think we got ourselves in a position to where one person gets to make all the decisions, and I don't think that's good. And I'll address the statutory duty, and we gave documentation to Gary, what happened in another county, and that may go up to the Supreme Court, that they ruled that the health director did not have the authority to take the actions that they took. Now, that's just in one county, correct, Gary?
Yes, that's all it applies to, but it was the state health director, not a local health director.
Right.
But it's still going to fall under one position, one person still making the decision, the way it's written. So if we split it or we don't split it, it's still one person.
Correct.
That person doesn't have to be a doctor. Maybe they'd have more sway to public opinion or not, I don't know, depending on the person, how they make their decisions. That's the way it goes, down to.
Okay. Anything else?
I don't know if you're going to, Jay, but could you make that roll call vote, please?
And your motion is just?
To split the position into two and to put it out for bid.
In following what dates?
Well, it may very well end up in June. By the time we put the thing out there, it could be 3 weeks, a month before we get anywhere. Then once you vet the potential applicants, then you have to forward that to the state. So that could be 2 months to 3 months already, and that gets us up to May. So we're only 1 month. This could very well fall in right in line with the current contract. So I think it's a necessary thing we need to do.
March, April, May, we're 4 months right now.
Yeah.
We're 3 months.
I think 3 months, bare minimum. So it might fall right in line with when the contract is potentially renewed, because the contract is going to change. There'll be wording in it that Gary will look at, and Kerry Hepting and all us will look at in the next contract. One would be the wages for it, I'm sure, because every contract changes. There'll be some changes in the contract and the wording once it comes up in June anyways, rather than just renew the current one. At least that's my belief.
Anything else? Roll call.
Commissioner Baldwin.
No.
Commissioner Rushing.
Yes.
Commissioner Vandenbosch.
Yes.
Commissioner Beeden.
No.
Commissioner McConnell.
Yes.
Chairman Bohm.
Yes.
Passes.
Okay, moving on to the communication plan, item B. Who's got item B? Anyone? Communication
Not I.
plan.
Duke might have had it, I don't know.
Does Duke have a page in?
Somebody make a motion.
Your motion?
Somebody make a motion.
I'm probably going to vote no for it, but I'll make the motion. Is this for final action, or, because this communication plan, we didn't have this at our committee meeting, did we, the way it's written?
That's correct. At the committee, you wanted me to discuss it with our emergency management director, our public health officer, and I also discussed it with the state to come back with changes, and that's the proposal. But just as a point of clarification, anything that is on your full board meeting is final action by nature.
So for final action, I will make the motion that this is for final action, and
Was it?
Support.
Is it still relevant?
what?
Is it still relevant?
Well, she wants to, it looks like a memo, that's why now we can have a conversation, because we got the motion made. But this is a memo, this isn't a actual communication plan, the way it's written, or any policy that's written.
Right.
It's kind of what you can do by yourself anyways, as our county administrator.
In reviewing this internally with staff, with departments, we have seen it's not just public health that has concerned citizens. We've had our board meetings filled with issues, concerns regarding animal control, various things throughout the year. So to single out two positions, communication between departments that fall under the under administration and the board is something that should fall on the administrator. Dr. Mercantant, I put the burden of communication on her on that when she discussed the public health order with me, so she called Jeff, and then I think we've rehashed that enough how that worked out. But going forward, when she reaches out to me, I need to start reaching out to commissioners immediately. Public health orders have been issued in the past, and there's been no concern from this board because people aren't in the room. There's a lot of things that happen that are going to have a big impact. Many times I reach out to you. It may be a complaint a department receives, that's something in your district. I'll reach out individually to the commissioner to say, here's what's going on in your district. Sometimes it's information that the whole board needs. Department heads are very good at running their departments, doing their jobs, but to navigate that communication piece, they're very good at communicating that with me, and I need to make sure that that goes up to the board instead of telling the department head, you're in the middle of trying to do all this work, but you need to call out the commissioners. So that's something administration should facilitate.
Yeah, I believe your memo, you do that anyways, our county administrator. Our initial discussion was because of Justin and Dr. Mercantant, because of their statutory duties. That's what the initial communication was, to where they would communicate with the county commissioners when they could, because sometimes you're going to have make instant decisions, and you won't have that luxury. But other times you will have, like the current flooding you have. You could easily have a plan in place that could give us to, hey, I'm looking to do this potentially with foresight with the flooding that's going on. And he might put something in place just so we get a heads up so we can talk to who we represent. If they get a phone call, we're not hitting the blind. I was given 2 hours on this. The mask mandate, if I would have been given some parameters on why we're doing this and how we're doing it, and had blessings from the school districts, but we weren't afforded that. And however we got there, we got there. So I'm all for the communication for Justin and Dr. Mercantile to be separate, but I think you already had this as a county administrator.
So as part of that, the state of Michigan was very concerned about the communication plan and the statutory authorities of that position, and putting something in place that hinders the public health officer's ability to act quickly. You know, arguably, a mask order is not something that has to be put in place within an hour, but she did cite many instances, you know, a contaminated water supply that within an hour that public health order went out. The health department has the response and they're already handing out filters and bottled water. We don't want to hinder that response, and I know the board's not looking to do that either, so I feel this communication plan appears to be very COVID specific. You know, Mr. Westmiller does not have independent authority to issue orders. They all need the board chair's approval. So there is communication there, and he always communicates with me, so I just need to make sure that that gets out to the rest of the board at the same time.
I've never had an issue with the communication piece of it. I mean, this is somewhat directed to what the recent happened, you know, with the net, which I told her to email the commissioner, so obviously that one's on me. So I personally, I think, you know, Dave, it's a memo. I think Carrie does it. I don't necessarily know we have to adopt a quasi-formal communication plan. I think we've always been well in the loop until it's really the one incident, right, until recently that spurred this. So considered a learning lesson. I don't think it needs to be a plan or.
I think it's good to have it though, have it as a written document.
Carrie, I think you do a fantastic job. I've told you that all the time. I think you're the best administrator we've had since I've been here, and I've been here 11 years. And we disagree on some things, but I think you're the most qualified we've had. Bill was fantastic. I think you're more qualified. The way this is written, 2/3 of it is addressing a lot of what we're brought here. And then the last part, you bring up your other department heads. So I don't like the way it's written. I think communication, you got numerous issues here, and then you close with all the department heads communicating. In the top part, the top 2/3, you're doing with the health department.
Anything else?
That's it.
Well, so if you put it in a policy form though, and there isn't the time, if it's in a policy form and it's not in the time, then is someone violating the policy?
I think she could write a better memo myself, but if we approve this tonight, then this is going to be the communication plan. And the way this is written, I don't like the way it's written, because you're referencing a specific issues that got us to where we're at tonight. And then at the end, you're bringing up departments are expected to communicate timely. So you're taking the rest of the county, but the initial part of this, 2/3 of it has to do with the health officer.
But because your initial request had to do specifically with the health officer, I broadened it to include any administrative department, because there's issues that can arise in any department that can cause public concern. So I don't think singling out two departments, I think it should be a standard that any department that reports to administration, and they all do communicate with me timely. I don't have issues with any of my department heads not keeping me informed as to what's going on. I'll make sure that the board gets that information timely instead of putting that burden on that employee to do, which, you know, Dr. Mercantile did. She began with in calling Jeff, and then the email went out per Jeff's instructions. So at that point, I would have started making calls to commissioners going forward.
I'm belaboring this far too much, I think, because it's just a memo for a communication plan. But is this what we're going to use as documentation for Justin and Dr. Mercantile or whoever has those positions and all the department heads? This is going to be the guideline then?
This memo says that you're going to hold me accountable to making sure you're properly communicated with.
We'd do that anyways.
So, you know, if Dr. Mercantile or any of my department heads informs me of something and I don't let the board know, then that's on me. That's not on them. That's what this memo says.
But I don't think intended to be adopted as a policy or something, more just the practice.
We had a motion, it's supposed to be for final action, take action on it, that's why it's on the agenda, we're to do business, if we're gonna vote on this, this is the communication plan from this part going forward, correct, Jay?
Well, I mean, if that's the document that's submitted as the item on the agenda, yeah.
Which you can always tweak that too. I mean,
Right.
if you want to adopt it, and you say, I'd like to make a couple tweaks, you can bring back a tweaked quasi-communication plan. If you want to vote it down and you want to put it on the agenda, probably, what I'm hearing is if you vote it down and maybe make a couple tweaks to it and bring it back in the March, unless you're happy to do it now. I mean, it's this.
Or just take no action. Yeah. You just take no
I
action?
myself, I'd like that, something a little more generic where it puts everybody, you don't have the health department or Justin, it just, anybody needs to communicate with you.
So just as order of things, if I may, Chairman Bohm, you could withdraw your motion and no one could make a motion and that action would die. And so then, maybe I'm one step out of school here from what my position is here, but that would allow you guys to individually have discussions with Carrie about how you want to structure communication.
We've had, at least I've had my part of the discussion, I've probably talked too much tonight, but I can withdraw my motion then. I don't know who seconded.
I did.
Dave.
I'll move my second.
Okay.
So if there is no motion on the communication plan, the item dies.
Okay, moving on. Item C, approval of county disbursements.
This time I'd like to make a motion to approve the January 2022 county disbursements in the amount of $20,336,465.95.
Support.
Thank you.
Discussion. Roll call.
Hang on, I'm catching
No,
up.
sorry.
Commissioner Beaton,
Yes.
Commissioner Rushing,
Yes.
Commissioner McConnell,
Yes.
Commissioner Vanden Bosch,
Yes.
Commissioner Baldwin,
Yes.
Chairman Bohm.
Yes. Item D, the intergovernmental service agreement.
Mr. Chair, I'd like to make a motion to approve the intergovernmental agreement with the U.S. Immigration Custom Enforcement Office for a term of 60 months as presented.
Definitely yes.
Discussion. Roll call.
Commissioner Vanden Bosch,
Yes.
Commissioner Rushing,
Yes.
Commissioner Baldwin,
Yes.
Commissioner McConnell,
Yes.
Commissioner Beaton,
Yes.
Commissioner Bohm.
Yes. Item E, the contract approval request.
This time I move to approve the agreement with the Overdrive Incorporated for e-book and audio distribution services for the library system for a term of 3/01/22 to 2/28/25 in the amount of $198,000.
Support.
Discussion. Roll call.
Commissioner Baldwin,
Yes.
Commissioner Rushing,
Yes.
Commissioner Beaton,
Yes.
Commissioner Vanden Bosch,
Yes.
Commissioner McConnell,
Yes.
Chairman Bohm.
Yes. Item F, the contract approval request.
At this time, I'd like to make a motion to approve the agreement with Community Education Network for internet service for the library system for a term of July 1st, 2022 through June 30th, 2025 in the amount of $243,000.
Support.
Discussion. Roll call.
Commissioner Rushing,
Yes.
Commissioner Beaton,
Yes.
Commissioner McConnell,
Yes.
Commissioner Vanden Bosch,
Yes.
Commissioner Baldwin,
Yes.
Chairman Bohm.
Yes. Item G, resolution 2022-03.
I would make a motion to adopt Resolution 22-03, placing the senior millage renewal on the ballot.
Support?
Discussion.
Yeah. What age does that start at?
Yours.
How old are you?
They send you ARP cards at 50 and the 49 and a half, just for the record. Roll call.
Commissioner Baldwin,
Yes.
Commissioner Beaton,
Yes.
Commissioner Rushing,
Yes.
Commissioner Vanden Bosch,
Yes.
Commissioner McConnell,
Yes.
Chairman Bohm.
Yes. Item H, the Circuit Court Family Division wage class change.
This time I move to approve the wage class change of the juvenile attorney referee position in the family court manning table to wage class III-K, or is that 3K? 3K.
Support.
Discussion. All in favor?
Aye.
Aye.
Those opposed. Item I, contract approval.
Motion by Baldwin, Jay?
Got it.
To approve the agreement with the Justice Works LLC to continue the subscription service for a term of 1/1/22 to 12/31/22, amounting to a total of $17,250 since 2020 for the Public Defender's Office.
Support.
Discussion? Roll call.
Commissioner Vanden Bosch.
Yes.
Commissioner McConnell.
Yes.
Commissioner Rushing.
Yes.
Commissioner Baldwin.
Yes.
Commissioner Beeden.
Yes.
Chairman Bohm.
Yes. Item J, the probate court manning table.
Mr. Chair, I'd like to make a motion to approve proposed manning table changes for probate court, converting clerk 1 position to clerk 3, converting a part-time clerk 3 position to full-time, eliminating 2 part-time at-risk youth workers, and 50% of the funding for a therapist.
Support.
Discussion? All in favor?
Aye.
Those opposed? Item K, Friends of the St. Clair River.
Motion by Baldwin to approve the agreement with the Friends of the St. Clair River for stewardship and services for 2022 in the amount of $30,850.
Support, Beeden?
Any discussion? Roll call.
Commissioner McConnell.
Yes.
Commissioner Baldwin.
Yes.
Commissioner Vanden Bosch.
Yes.
Commissioner Beeden.
Yes.
Commissioner Rushing.
Yes.
Chairman Bohm.
Yes. Item L, landfill survey rover purchase.
Mr. Chair, I'd like to make a motion to approve the purchase of a survey rover for the landfill in the amount of $25,100.97.
Support.
Discussion. Roll call.
Commissioner Beeden.
Yes.
Commissioner Baldwin.
Yes.
Commissioner Rushing.
Yes.
Commissioner Vanden Bosch.
Yes.
Commissioner McConnell.
Yes.
Chairman Bohm.
Yes. Item M, Parks and Recreation Commission appointment.
At this time, I'd like to make a motion to appoint Cindy Babbitts to the Parks and Recreation Commission Board, representing Districts 6 and 7 for the remainder of a 3-year term expiring December 31st, 2024.
Support.
Discussion. All in favor?
Aye.
Those opposed? Item N.
I would make a motion to adopt Resolution 22-02, placing the Parks and Rec Commission millage renewal on the ballot.
Support.
Discussion.
This is the same as prior, correct?
Same as prior. Nancy's in attendance too, if you got any questions. Okay. All in favor?
Aye.
Oh, roll call, I'm sorry.
Commissioner Vanden Bosch.
Yes.
Commissioner Baldwin.
Yes.
Commissioner McConnell.
Yes.
Commissioner Rushing.
Yes.
Commissioner Beeden.
Yes.
Commissioner Bohm.
Yes. Item O, the ARPA projects commissioner districts.
This time I move to approve the Commissioner District American Rescue Plan project as presented.
Support.
Want to do discussion?
Just a little. This has to do, I guess, basically with the 6 or 7 that I've given you to get approval for funding, and then they're going to forward information to the 6 townships and the city of Memphis.
Yep, that's correct. They will all get a letter along with instructions on what they need to do for
Because
reimbursement.
we're going to be meeting with the townships later, and I want to fill them in best I could.
It also includes one of my projects for the generator for the emergency management system.
Is it possible to get a copy of what is being sent out? So if, as we're talking to municipalities, they know what will be required of them to make sure that it fits what they want to do ahead of actually submitting?
Sure, absolutely. It's what we're asking. It's just basically the paperwork that's required for reimbursement. But yep, we can send everyone a copy of the form that'll be going out.
Thank you.
If we gave you a list of the monetary amounts that they're each receiving, could you just send then out a letter to them saying, in order to receive your 50,000, 30,000, 25,000, you need, these are the forms?
We do like to know what they intend to do with the funds, and that
Okay.
will come back to the board for approval, because we do want to make sure how it's being spent is in line with what's allowed.
Right. Okay.
And I think that some of the question municipalities have are, so what do I have to do if I get this money? So I would like to have that conversation prior to them even submitting, so we're not wasting anybody's time.
So roll call on this. right?
Are you allocating dollars right now? Because you're not.
We are allocating for this one, there'll be $500,000 to my district once she gets the letters out.
Yeah.
Gotcha. Commissioner Rushing?
Yes.
Commissioner Beeden?
Yes.
Commissioner Baldwin?
Yes.
Commissioner Vanabosh?
Yes.
Commissioner McConnell?
Yes.
Chairman Bone?
Yes. Item P, the Marine Safety Program Grant.
I would make a motion to approve the fiscal year 2022 Marine Safety Program grant application in the amount of $321,363.
Support. Baldwin.
Discussion. All in favor?
Aye.
Those opposed? Item Q, contract extension approval
At
request.
this time, I'd like to make a motion to approve the contract extension with Interwest Technology Group for the Health Department expiring May 31st, 2022, in the amount of $15,920.
Support.
Discussion. Roll call.
Commissioner Beeden?
Yes.
Commissioner Rushing?
Yes.
Commissioner Vanabosh?
Yes.
Commissioner McConnell?
Yes.
Commissioner Baldwin?
Yes.
Chairman Bone?
Yes. Item R, tree harvesting agreement.
Mr. Chair, I'd like to make a motion to approve the agreement for the sale and harvesting of hardwood trees with Tri-County Logging, Inc. for the airport in the amount of $21,500.
Support.
Discussion. Roll call.
Commissioner Baldwin?
Yes.
Commissioner Vanabosh?
Yes.
Commissioner Rushing?
Yes.
Commissioner Beeden?
Yes.
Commissioner McConnell?
Yes.
Chairman Bone?
Yes. Item S.
This time I'd like to make a motion to approve the project to relocate the Parks and Recreation Admin Office in an amount not to exceed $40,000.
Support, Beeden.
Discussion.
Where are they moving it? Please fill me in.
It's in our packet,
didn't
but
look
out
at
to,
it, I'm
out to
sorry.
Goodles. To
There
the
was
garden
other
center.
things I went over quite extensively.
Yeah, I
The garden
think
center, like.
Nancy's here. You want to chime in quick?
Commissioners, we are looking to move to Goodles in the Garden Center, so it's a facility that we already have. We feel like it'd be better to bring the team together, so we have more administrative support to the managers there. It also, we have a lot of people that come looking for contracts and things like that at Goodles, thinking that's what we're at anyways. So we feel like this will be a good move to kind of, make our team more efficient as well, so. There's a lot of repairs there that just needed to probably be done anyways, things like, electrical that needed to be repaired anyway, and a security system that needs to go in there, and just, some walls and stuff, so we can have some offices in there.
And you're going to change the physical location of where you're currently at?
Yes,
And where's that going to be?
at the garden center, at Goodles. You mean,
At where?
at the garden center, which is right next to the operations center at Goodles? I think the Earth Keepers used to be there in the past.
Oh, so you'll be in my district?
Yes.
Okay.
We're hoping to be
I got
more
it.
available to residents, so.
Will your meetings be there?
I don't know that we'll probably do the community center, but it'll be at Goodles,
Okay.
yes. Thank you. Anything
Okay.
else?
Nope.
Okay.
Roll call.
Thank you.
Commissioner Beeden?
Yes.
Commissioner Baldwin?
Yes.
Commissioner Vanabosh?
Yes.
Commissioner McConnell?
Yes.
Commissioner Rushing?
Yes.
Chairman Bone?
Yes. Item 12, Administrator's Report.
Just a couple brief things this evening. We are going to be having a follow-up meeting with Senator Peters' office along with the airport to talk about our crosswind funding. I know this week our airport director, along with a representative from Strategic Communications, is at the Airport Managers Conference to speak with other airports. So we're hoping to have more information. I believe that meeting is the first week of March, where that was set for us to discuss our crosswind funding. Our landfill has filed a notice of intent with Eagle to apply for a pilot project to treat PFAS. is part of our wastewater treatment facility. It was just a notice of intent to apply, and then the formal presentation or grant application will come to you, but they were required to get that notice of intent to apply so they could attend the pre-award meetings. I have been in contact with Tri-Hospital and the City of Marysville, and we have a meeting that will be scheduled with Richmond Lennox as well, where we will all be discussing the potential of the ambulance millage. That has to come to the board fairly quickly if we're going to move forward with that, to get that on the August ballot. So our hope is to have that to you by the April meeting, correct, Jay?
And Richmond Lennox.
Yes, for EMS.
Richmond Lennox also.
Yes, Richmond Lennox, yep, they're, Ken Cummings has already contacted them, so all of the different ambulance services will be at this meeting to discuss and make sure everybody is in agreement before something comes to the board. I don't know the date yet. We went out for bids for aerial spraying for our gypsy moths based on the maps provided to us, or the areas by Friends of the St. Clair River. Those bids are due back tomorrow. There has been some interest. We know people have looked at the bids, pulled them down, so hopefully we get a couple bids that we can look at and bring that to you in March. The timeline for spraying is typically May. It depends on when the hatching season starts, but based on the Friends surveying, that'll be kind of determined once we have a sprayer on board. And last, our animal control office is now partnering with Michigan Works. So Michigan Works is providing them with employees at no cost to us. And what it is doing is it's giving those individuals some on-the-job training, stuff that they can put on their resume to help them get other jobs in the future. They're very short-term assignments. I believe they're maybe 90 days each, but they'll be able to do office tasks, some of the animal care, and that will help out with some of the staffing shortages we've had there, since we no longer, we still have not had any trustees since the beginning of COVID. So that's going to help alleviate some of that pressure.
Can I just throw a really quick plug in for you guys, which you probably don't know about Michigan Works? Nick Clark, who is currently running the transformation of the court management software from what it is today to what the new one is that you guys have approved that we're transferring to, he started in my office as a Michigan Works, and he's been there ever since. He built and designed our website that we use at the clerk's office, and he is now running that transition between those two softwares. So just a testament to, the kid is brilliant, by the way, but a testament to what the potential is from possibly. And he started in my office as a Michigan Works employee.
Mm-hmm. Excellent.
Fantastic story there.
Let's go.
That's all I have this evening.
Okay, motion for the administrator's report.
So moved.
Support. All in favor?
Aye.
Any miscellaneous business to come before us this evening?
Mr. Chair, I've got one thing. I was lucky enough, I was invited down to the Elginak Lions, and they were closing up their account for the fundraiser for the fire at Rolling Brook Apartments, because they wanted the money out of their account, basically, and account for it. And that we met with Blue Water Action and the Council on Aging, and they were hugely helpful to help guide the Lions and how they could dispense that money. We ended up giving, they settled, I believe, 10 to 11 people with security deposits and miscellaneous, items besides all the clothing and all that. But they also are going to write a check for $1,600 per resident. And I just wanted to think that it was a wonderful thing to see that community come together that quickly and respond the way they did. So, thank you.
Yeah, that was a horrible thing down there. No loss of life, thank goodness. Receive and file.
This time, I'd like to move to receive and file packets that were sent to commissioners, packets at their places, and any other information presented.
Support.
All in favor?
Aye.
Aye.
Those opposed. Item 15, adjournment.
Make motion.
Support.
All in favor?
Aye.
Aye.
We're adjourned.